Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on one of the important topics related to women, that is white discharge, or it is also known as leukorrhea. So there is a common misconception that leukorrhea is a disease. Basically, it is not a disease. There are two forms of leukorrhea. Leukorrhea is a symptom. So basically there are two forms of leukorrhea. One is a pathological form where you have certain diseases, especially vaginitis, then you get leukorrhea, or sometimes it is physiological. Physiolocal in some of the conditions, it is absolutely normal. We will differentiate what is pathological, what is leukorrhea, how to differentiate, and look into the leukorrhea which is normal, which is physiological. And also we will decode some of the myths. There are a lot of myths around leukorrhea. We will look deeply into it. This is especially for women who want to know more about leukorrhea, whether it is normal, abnormal, how to differentiate between normal leukorrhea, abnormal leukorrhea, and how to decode some of the misconceptions you have around leukorrhea. In order to understand leukorrhea, you need to understand some anatomy and physiology. Anatomy means normal structure and function of female organs from the perspective of leukorrhea. Basically, female will have labia majora, labia minora. These are the two structures. Between two labia minora, there will be a flat structure, that is vestibule. In vestibule, in the upper part, they will have clitoris, and just below the clitoris there will be urethral opening. Just below the urethral opening there is vaginal opening. On either side of vaginal opening there will be small opening, that is Bartholin glands, and the drugs opening from the Bartholin glands or Bartholin ducts. These are present on either side of vagina. Once you enter into vaginal orifice, there will be vagina, and connecting vagina and above uterus you will have cervix. Uterus then leads into two fallopian tubules. This fallopian tubules leads into fimbriae. At the end of fimbriae, you will have ovaries. This is the structure of female genitalia. And coming to the important histological feature you have to understand here is, in the vagina and cervix area, there are a lot of glands. Those are called vaginal glands. The main function of this vaginal glands is to secrete some mucus, that is vaginal fluid. And coming to the physiology of vagina, vagina is the organ where there will be sexual intercourse and ejaculation of sperm into it. Here you have the vaginal glands. These vaginal glands will secrete mucus. This is known as vaginal fluid. In the vagina of the female, along with this vaginal fluid, there are some other organisms. Those are bacteria, fungus, and protozoals. These are present in vagina of the women. These stay there as a commensal. Commensal is the association between two animals where there is no use and also no harm. For example, here the two animals are, first animal is human being and other animals are either bacteria, protozoa, or fungus. These come together and live in the vagina of the female, but there is no use or there is no harm. They live side by side, but there is no use or no harm in that association. This we call as commensalism. These are the some bacteria, fungus, and protozoans live as commensals in the vagina of the female. These are all common. This vaginal gland secretes fluid, that is vaginal fluid. This vaginal fluid varies from women to women and also on her stage or what stage of her menstrual cycle she is. This will change. Every woman has distinct amount of vaginal fluid secreted per day. The consistency or the color or the odor of this fluid is different from women to women. Normally this is clear, relatively odorless and whitish color fluid, and the pH is slightly acidic. This is about 3.8 to 4.5 of pH. And also there are some bacteria, that is lactobacillus. Lactobacillus normally lives in gut intestine of a human being, but even in the vagina of the women there is some lactobacillus present as a commensal. What are the uses of this vaginal fluid? This vaginal fluid helps in keeping the vagina clean. That is the first one. It keeps the vagina moist always, and also during sexual intercourse it acts as a lubricant. It prevents the infection of vagina, and also it prevents the accumulation of dirt in the vagina of the women. It also helps in balancing the pH so that the sperm released into vagina will stay alive. It swims through cervix and reaches the fallopian tubule to fertilize. These are the functions of vaginal fluid.